Hi everyone, it's Ashley again, and I'm going to be speaking to you today about our introduction and also our problem statement for this project. And the need for healthcare has really been on the rise for the last 200 or so years. Doctors were once only available to the wealthiest people who can actually afford to be seen. A lot of times, doctor visits were um, on more of like a personal basis to where they would come and do like home health, like doctors would go to houses. But as technologies emerged, so did access to healthcare for some people. The evolution of the hospital has occurred over several stages, and the community based hospitals were created during the late 1800s. This provided a little bit more access for people to get care, especially for those who couldn't afford it, who couldn't afford like a house call. But around the 1930s is when private insurance kind of arrived on the scene, which enabled more people to pay for hospital and preventative care services. But unfortunately, there was limited access to health insurance in rural and heavily urban areas with minority populations. So Medicare and Medicaid were created, and today's community healthcare involves both centers, so smaller organizations, and also larger community hospitals. And since public health insurances like Medicare and Medicaid are accepted in community hospitals, the majority patient population inside of these systems are going to be lower income minorities. Community healthcare settings, they do offer a wide variety of different specialists, doctors, primary care physicians, nurses, and even social workers. And community health centers focus more on preventative care and include things even like dentists and therapists, to whereas community health like hospitals, the larger scale networks, they really focus on more acute issues and shorter stays. Special institutional and community based settings have been developed for longer term care, especially for mental health situations. Community health centers do rely on a combination of Medicaid and Medicare payments, grants, and other public and private funding to fund their operations. And as you can see in our little picture here, we actually have the hospital as a system as a little flow chart, and the inputs are going to be like personnel, money, information, materials, time, equipment, and tools, and the processing is pretty much all the care that all those personnel and those people provide to the patients. And hopefully, the outcome is a better, healthier quality of life for those associated.